Thank you for this introduction, Jackie, and introduction of me personally, but also of the topic, because I'm exactly going to present about the issues of social protection and inclusion, or as it states here, inclusive social protection, and challenging assumptions and managing expectations. So to what extent can we expect and assume social protection to be inclusive? And it's a daunting task to be on the last panel of this forum, but also a good opportunity because in this presentation I will both echo and challenge some of the things that we've been hearing over the last 2 days. Right. Okay, so to start off with the rise of social protection. Well, we're here, of course, because social protection has been given so much attention, because it's risen up the agendas, and because it's been seen, as Sarah Cook mentioned yesterday morning, as a quiet revolution, or as others have called it, the development success story of the last decades. And so it's become part and parcel of the development policy toolkit. And some of the factors that have led to this are listed here and have been discussed. The economic crisis, increase in inequality, persistent levels of poverty and food insecurity have contributed to people looking at social protection for addressing these problems. We've also heard about the expanding evidence base, and particularly evidence base that points towards positive impacts of social protection that have also contributed to its increase in popularity. And finally, something that I haven't really heard in these last 2 days, it's also related, I think, to the post-2015 agenda. A lot of debate and discussion about what the development framework should look like post-2015, and again, social protection is likely to feature high on that agenda for a number of reasons. One of them is the issues that are on that agenda. Some of them are first bullet points, so persistent poverty, growing inequality, but also other issues that relate to people's volatility and increase in shocks, such as climate change. Another reason why social protection relates well to the post-2015 agenda is because of some of the underlying principles that are being put forward for that post-2015 framework, which include human rights, equality and equity, as well as sustainability. So in some of the work that's been put forward, such as the UN task team, social protection is being mentioned as one of the main tools towards inclusive economic and social development. So I think it's important to keep that in mind as well. So with that, with this growing momentum, I think it's also very timely to take a step back and, as it says here, to inject a healthy dose of realism, and to challenge some of the assumptions and manage some of the expectations that have been loaded onto social protection in recent years. And I will do this particularly in terms of inclusive social protection for social inclusion. Now, what do I mean when I talk about inclusive social protection? In the paper that I've written for this panel, I've looked at inclusive social protection from 2 different perspectives. First of all, considering the reach of social protection, the extent to which it covers those people who need it. So yesterday morning we heard a presentation about Indonesia, where it was said that 12% of people are poor. But actually, when we look at people close to the poverty line and look at vulnerability, rather, it's closer to 40%. Now, this is a massive proportion of the population, and so in effect, we might actually only reach 25% with social protection, and if we can do that, that's already a massive achievement. But if you think about that in terms of inclusion, inclusive social protection, obviously 15% is excluded, and so it wouldn't be a very inclusive social protection, a way of social protection. The second aspect is the extent to which social protection leads to inclusive economic and social development, or leads to economic and social inclusion. So as Jackie said, there is an assumption that when there is economic growth, we heard about pro-poor growth and inclusive growth, there is an assumption that it will benefit the most marginalized, the poorest, that they will be benefiting from the economic growth, that it will reduce inequality, that they will be benefiting equally. And this might not be the case. And I'm going to discuss this with respect to 4 different issues. So I'm going to go over each of these in more detail. And these are issues around assumptions and expectations of social protection that might actually undermine their inclusiveness, both in terms of that reach aspect as well as the extent to which it has the impact that it wants to have with respect to economic and social inclusion. The first one is individualistic understandings of poverty. The second one, graduation as the be-all and end-all of social protection. Cash and conditions. We've heard this morning, we've heard Rachel say that she feels targeting and conditions are maybe 2 of the most hotly debated topics in social protection. I will briefly touch upon that. And finally, something that we haven't really discussed yet, around human resource solutions in implementing and delivering social protection. Okay. So the first issue, individualistic understandings of poverty. What do I mean with that? Well, we've heard a lot about poverty reduction, especially yesterday. We talked about what actually helps people to grow out of poverty to sustain themselves. And we've heard Simone say in reference to Latin America that one of the big factors was the creation of formal jobs. In Fabio's presentation yesterday, we heard that in addition to having jobs, it's also important that these jobs have wages that ensure that people don't go from poor to working poor. So in other words, there are some structural factors there that were very important in terms of poverty reduction. But if we look at theories of change, the logic underlying many social protection programs, we can see that a lot of them are focused on individual and household level barriers and constraints and lifting those barriers and constraints towards reaching positive outcomes. So I want to show you this diagram, which is a complicated way of showing the theory of change for the child support grant in South Africa. And I don't know if you can see it very well, but on the right-hand side, it goes from activities to outputs, short-term, medium-term, and long-term outcomes. And the activities are first of all the targeting exercise, then the payment of the cash transfer, and so is increased consumption, increased expenditure, different expenditures in different areas, and then it goes into outcomes such as improved nutritional status, educational outcomes, and finally at the bottom, improved levels of mobility, but also poverty reduction and economic growth. Now, if you look at this in more detail, all of these issues are individual household level, are to do with individual household level constraints or positive impacts. The only mention of anything outside is in that little red circle, which is about coverage and quality of services. So that's the only aspect of any sort of structural constraint or barrier that would limit a positive outcome for households with children in South Africa. So despite the fact that we've been talking these last 2 days about the importance of supply, about the importance of linking up to other services, of integrating policies, if you look at individual social protection programs, there is still an assumption that it's all down to the individual. And that failure to acknowledge structural constraints is an issue both in terms of the reach and also in terms of the impact and what that does to the inclusiveness of social protection. And I just want to illustrate this a bit more with the example of the girl in the picture on the right-hand side. This is a girl from an indigenous group in Mexico, and she is on the Oportunidades conditional cash transfer program. Now, we've done some research on that program with respect to indigenous people, and we find that they are disadvantaged and excluded, both in terms of reach as well as in terms of impact. Many indigenous people live in remote areas, so access to services is difficult, services aren't available, and also there's a high opportunity cost to access services. But it's a conditional cash transfer program. So there is evidence that people have been pushed off the program because they weren't able to comply with conditions, either because they couldn't get to the school or health clinic, or because the school or health clinic wasn't available. So very vulnerable and marginalized, if not the most vulnerable and marginalized, are excluded. But then even if this girl makes it to the school, and the household gets the transfer, the impact, as it's assumed within the logic, theory of change of oportunidades, may not play out as it's supposed to. First of all, because they live in remote areas, the quality of schooling is probably not as good as it would be for other children. Secondly, once they graduate and go on to the labor market, indigenous people are often discriminated against, so it's more difficult for them to find a job or to find a good job. And thirdly, they're also often faced with lower wages. So even if they do get a job that's fairly okay, they often get paid less than other people would. So the assumption within a conditional cash transfer program of human capital investment, and through that better long-term incomes, is seriously compromised in this case. And the result of that is, of these individualistic understandings, is that there are unrealistic expectations of individuals and households, and also very unreasonable responsibilities put on them. There's a notion that if they do not reach that long-term outcome, it's their own failure. The second issue I'd like to discuss is the notion of graduation. Graduation as the be-all and end-all of social protection, as the main objective. It's not a term I've heard used very much these last 2 days, but it is quite big in social protection debate. Graduation meaning the extent to which households can lift themselves out of poverty over particular thresholds, and once they make it above that, they can sustain themselves and will not fall back into poverty, and they don't need any support in terms of transfers. And often this is seen as an antidote to dependency syndrome. So we heard Vivi talk about dependency this morning, and the widespread concerns about social protection being seen as a handout and people no longer taking their own responsibility. And the focus on graduation, on social protection as working towards being able to sustain yourself, is a response to that, is trying to counteract that concern of social protection just being a cash or transfer handout. But it's not that simple. Graduation, or many programs that try to achieve graduation, are public works programs. And the picture on the right is from the VUP program in Rwanda, and here people are making terraces so they can farm the lands. And terracing is part of the public works activity. The evidence on public works program and the extent to which they lead to graduation is still thin. That's partly because some of these programs haven't been in place very long. But also when we talk about graduation, we talk about sustainable graduation, so over a long period of time, and we just don't have that evidence yet. But within that, there are problems with public works programs. Oftentimes, the pay is low, so the extent to which people can actually build up assets to make it above a threshold is the probability for doing that is low. There's also often an assumption within public works programs that people learn skills that they can then actually use in jobs somewhere else. But building terraces isn't particularly high-skilled work, and oftentimes these public works programs involve infrastructure building, So that's also questionable. So the extent to which people can actually graduate and make it above a threshold is difficult. And this is an issue in many ongoing programs, including VUP as well as the productive safety net program in Ethiopia. There's an expectation, there's an objective for a number of people to graduate, and that objective is not being met at the moment. So policymakers at local level are increasingly experiencing pressures to graduate people even though they're not ready, leading to premature graduation. So people are being pushed off the program even though they're not ready. And some may say that that can actually increase dependency rather than decrease dependency. People will try very hard to stay on the program because they know that once they are off the program, they don't have any means to support themselves. And a second point related to that is that a focus on graduation limits the protection element of social protection. And this is where I would challenge what Sarah said yesterday morning. She argued that a lot of social protection has been focused on social safety nets, on protecting people. What we see in debates is actually that social protection is much more pushed towards the promotive and productive elements, the extent to which it can help people out of poverty in a way that they don't need support anymore in the future, so to counteract the dependency. But actually there are always people who will need social protection, the elderly, the chronically ill, the disabled, and if we focus on this productive element, exclusively, we will miss those people out. And so there is this, again, this aspect of not reaching the people we need to reach and undermining the inclusiveness of social protection. I've already had my first sign up for the time, so I will go through my other two issues fairly briefly. This third issue was around cash and conditions being used as an incentive to lead to behavioral change. And the first point here, and also the picture, relates to what Rachel was saying this morning about targeting women and how that could lead to gender empowerment or gender equality. There are a lot of assumptions in using cash and conditions and what they do in terms of empowering women, empowering households, changing behavior within households. And so, for example, giving cash directly to women doesn't at all mean that gender inequality decreases. It actually often perpetuates patterns of gender inequality. Cash is also sometimes used as an incentive to try and get children in foster care or kinship care. This is another example of how cash can be used as an incentive for changing behavior. This is especially the case in contexts where there is a high orphan burden or where people are trying to move children from institutional care or foster care. Again, that might seem like an attractive opportunity, but there are potentials for perverse incentives as well. In Botswana we saw this so-called phenomenon of commodification of children, whereby carers were willing to take in children because of the transfer that was attached to it, rather than for actually wanting to care for the children. So we need to be very careful around these assumptions. And the same holds for conditions. First off, a conditional cash transfer, when we talk about inclusive social protection, excludes by definition. So we attach a condition to the receipt of cash. If it's attached to children going to school, that means that a poor household without children is automatically excluded. And so there will either have to be another program to support these people for it to be an inclusive social protection system. And then again, there's all sorts of issues around the positive effects and perverse incentives of conditions within conditional cash transfer programs. There is a big evidence base that conditional cash transfer programs have positive impacts. The extent to which that is attributable to the condition or not is still debatable. But we also have to be very aware of the perverse incentives that it can create. The picture there shows a woman in the Bab refugee camp in Kenya, where they were handing out food vouchers on the condition that children were malnourished. So the evaluation of action against hunger found that in some cases mothers were keeping their children underweight, so they would still qualify for the benefits. Very briefly, the final point on human resource solutions. We haven't talked about it very much. I do think it's an issue to think about. Who is going to implement, deliver all these programs that are growing, that are scaling up? One of the opportunities that many countries are looking at, including Indonesia, is the use of community mechanisms. And in some cases, very low resource contexts, it's working with community volunteers. And we've heard in the presentation just before this session that there are many benefits to community involvement. It creates ownership, there's engagement. Obviously community members are at the forefront, they know what the needs are. But I think we also need to think a bit more critically about what we can ask volunteers to do, especially in very poor conditions. This is a community committee in Ethiopia who are implementing, delivering a cash transfer program. They told us that sometimes they spend about 3 days per week working on that program. They don't get any remuneration. So this means that it really impinges on their own possibilities to sustain themselves, to support their own livelihoods. And we had some discussions with local governments, and they were all very positive about the community involvement and didn't want to see how this also creates great pressure on people. So I will skip over this and come to my conclusion. So in order to make social protection inclusive, first of all, I think social protection should be subject to a bit more interrogation. So this links very much to Rachel's point this morning. Unpacking some of the myths, some of the assumptions, and also some of the expectations we have. And in terms of expectations, there I would also like to challenge Mike Sampson, who unfortunately has left us, but he made a very passionate call for social protection on the basis that it will lead to economic growth. Now that may be true, and that's great, but that's quite an assumption to make, and also quite an expectation of social protection. And I agree with the needs for making an investment case to convince politicians and policymakers that social protection is worth investing in. But if we do it on the basis of very high expectations, there's also a real risk of a backlash. And so that in 10 years' time, the politicians and policymakers come back to us and say, well, social protection didn't really deliver what it was supposed to, so maybe we should just forget about it altogether. Second point, it needs a broader evidence base. This has also been said before. 2 points about that. One is, what I mean with the broader evidence base is that it should, it's not so much about whether to use RCTs or not, or whether to use mixed methods or not, but it's about looking at issues that are beyond the logic of a program. So I showed you the theory of change of the child support grants in South Africa. Most of the evaluations will test the assumptions within that framework of a particular program. And so that doesn't allow you to look at some of the perverse incentives, some of the negative side effects. And if we don't have any idea of those, that can seriously compromise how we think about social protection, how it works. And secondly, we need more information about the longer term effects. So again, if we talk about program evaluations, the data collection efforts are often linked to the particular program cycle, and it stops when the program stops. But we need more information about what happens in 2 years, 5 years, 10 years' time. In terms of policy, to make social protection inclusive, I really do think it should be rights-based and demand-driven, so that those most vulnerable and marginalized can hold government to account and can make claims to their entitlements. And also finally, the program should really be, within the programs, it should be acknowledged that they are part of a wider system and set of policies. So it's all good to say it should link up, but when we look at the design of individual programs and the logic, there we should already recognize that this should link up, not only with coverage and quality of services, but also with labor market policy, for example, so that the wage differential and access to labor market is also considered. And I'll leave it there.